Quality of care, along with comfort, compassion, and communication, are hallmarks of our cardiac surgery program here at Spectrum Health's Fred and Lena Meyer Heart Center. In this video, we will briefly discuss common types of heart surgeries, the days leading up to surgery, the day of surgery, hospital recovery, and preparing for home. Common types of heart surgery. There are various types of cardiac surgeries, often referred to as open heart surgeries. These procedures include coronary artery bypass grafting, in which narrowed coronary arteries are bypassed by other healthy vessels, repairing or replacing faulty heart valves, repairing aortic aneurysms, which are bulges on the aorta. The aorta is the large artery leaving the top of the heart, which supplies the blood to the entire body. If you have questions about your own particular heart surgery, please talk to your heart surgeon. At Spectrum Health, we have highly qualified and experienced surgeons employing the latest technologies in the treatments of these and many other heart conditions. They want you to clearly understand everything about your treatment plan. The days leading up to surgery. Once your heart surgery is scheduled, you will be contacted by Spectrum Health's pre-procedure planning team. A member of this team will verify your health history, medications, and emergency contact information. It's important to share with this team member any information that might help us better prepare you and your care team for surgery. If you live more than an hour away, we suggest you consider staying at the Spectrum Health's Ranucci Hospitality House the night before surgery. Your family may wish to stay there through your recovery. The Ranucci House offers affordable, hotel-like accommodations and is conveniently located adjacent to the hospital. To increase the likelihood of room availability, we recommend reserving accommodations at the Ranucci House well before your day of surgery. The surgeon's office staff can provide you with an informational brochure about this hospitality house. To help decrease the risk of infection, you will be given a special antiseptic skin cleanser that will be used to wash your skin before your surgery. This involves a shower the night before surgery and the morning of surgery before you arrive at the hospital. The areas to be washed and how it is to be done will be explained in detail to you before your scheduled surgery date. Men, do not remove any chest hair yourself before surgery. This will be done at the hospital before your procedure. After the evening shower, sleep in clean clothing and between clean sheets on your bed. Next, it's important to be adequately hydrated before your surgery. Please drink 2 large glasses of water the evening before your surgery. Eat no food after midnight. You may drink only water up to 4 hours before your surgery start time. Also, drink no alcoholic beverages for 1 week prior to your surgery. It's important to take your medications as directed by your surgeon in the days prior to your surgery. On the day of surgery, bring only your list of medications to the hospital. Do not bring any of your medication bottles. On the morning of surgery, take the medications as prescribed with a sip of water before you leave home. The day of surgery. Please remove all jewelry, including body jewelry, for safekeeping prior to your arrival to the hospital. However, if you wear glasses, use hearing aids, or wear dentures, bring them with you. Be sure to bring along any containers you typically store these items in. If you wear CPAP or BiPAP at night, bring your mask and hose from home. Do not bring your machine. We will have one available at the hospital for you to use. On the day of surgery, arrive at the Barclay Street entrance of the Meyer Heart Center. Free valet parking is available for the car you arrive in. Please leave your bag of personal belongings in the car. Your family may bring this to you the day after surgery once you are settled in your room. Upon entering the hospital, you will be directed to the registration area. After registering, you will be directed to the second floor. The surgical intake area, surgery suite, family waiting areas, and the cardiovascular recovery unit are all located on this floor. You will be greeted by the receptionist on the second floor and will be led to the surgical intake area, along with up to 2 family members or caregivers. Here, you'll be prepared for surgery. You will be weighed, dressed in a hospital attire, and an intravenous catheter will be inserted into your arm. Any unwanted hair in the surgical sites will be removed. Your nurse will review your personal information and medical history and will verify that you have followed all your pre-operative instructions. While in the surgical intake area, you will talk to your surgeon and the anesthesiologist. The operating room nurse will also meet with you and your family. This nurse will provide your family with periodic updates during your surgery. Once these tasks are completed, other family members and clergy may see you in this intake area prior to your surgery. Your anesthesiologist will escort you to surgery while your family returns to the family waiting area. In most cases, the first surgical update happens 2 hours after surgery begins and then at intervals thereafter. If your family members leave the waiting area during your surgery, we ask that they leave a phone number with the receptionist in case they need to be contacted. Remember, most heart surgeries take 3 to 6 hours to complete, depending on the type of surgery and the surgical approach used. Once your surgery is completed, the surgeon will speak with your family in a private room in the family waiting area while you are being transferred from the surgical suite to the cardiovascular recovery unit, known as the CVRU. You will be asleep from the anesthetic for the first hours after surgery. During this time, you will be connected to multiple tubes and medical devices as well as intravenous fluids. These all are very important as you go through the first hours of recovery. A breathing tube connected to a ventilator is necessary while the anesthesia leaves your body. Once you can breathe on your own, the ventilator and breathing tube will be removed. Family or caregivers will be invited to see you approximately 2 hours after the surgeon speaks with them in the waiting area. The bedside nurse will explain the visiting routine to your family during this post-operative phase. You will look somewhat pale and puffy after surgery due to fluids given to you during surgery. This puffiness is completely normal and will gradually subside as you recover. As you wake up from your surgery, you can expect to be achy and painful. Your nurse will work with you to achieve control of your pain. Once the breathing tube is removed, your nurse will also help you with breathing exercises to help regain the strength of your lungs. These exercises will help to keep your lungs clear and prevent breathing complications. You will remain in the recovery area until the morning after surgery. In the evening, if your condition is stable, the staff will encourage your family to return home for a good night's rest. A designated family member may call your nurse throughout the night for updates and keep other family members informed of your progress. Hospital recovery. The morning after surgery, the surgeon, along with his or her team, will evaluate your progress and determine the level of care you will need. If your condition warrants additional intensive care time, you will be transferred to the Cardiothoracic Intensive Care Unit on the 5th floor of the Meyer Heart Center. If you no longer need intensive care, you will be transferred to the Cardiothoracic Post-Surgical Unit on the 7th floor of the Meyer Heart Center. Your family should check for your location at the information desk on the 1st floor of the Meyer Heart Center the day after surgery when they come to visit. The day after surgery, your activities will begin. Movement, especially walking after surgery, improves your circulation, makes you breathe deeper, and increases your bowel function. All these are essential for a good recovery. The staff will assist you with sitting in a chair for meals and accompanying you with walking initially. For your safety, the staff will apply a gait belt around your waist and gently support your movements. Our goal is for you to regain your strength and become independent in your walking and self-care. If your progression is slow, occupational and physical therapy will be consulted for recommendations of techniques and equipment that will promote your safe movements. This is essential for your safe transition to home. While in the hospital, it's important that you continue to use the breathing tool hourly to help you breathe deeply. Your bedside nurse will remind you to do this task. You will continue to use this instrument throughout the day, as well as when you return home, until you can walk briskly and breathe deeply naturally. Good pain control is essential for good movement and deep breathing. Continue to discuss pain management with your nurse and develop a plan so you can move comfortably and be restful throughout the day. We encourage you to hold your heart pillow against your chest to support the chest wall while doing activities and coughing. If your surgery was done through your sternum, or commonly known as your breastbone, you must adhere to sternal precautions over the next several months while the bone heals. The sternum was secured with stainless steel wires, which are permanent. Your bone mends and heals over these wires, but this takes time. You will be instructed to limit the weight you may lift and how to move your arms safely for good bone healing. Each morning you will be weighed to determine if the body swelling has gone down. To help reduce the swelling, elevate your legs while sitting in the chair. It is also helpful to lay in your bed several times a day with your legs higher than your heart. You can expect to have a decreased appetite after surgery. This is normal and will gradually improve over time. Try eating smaller quantities of food throughout the day. Constipation is a common side effect of some pain medications, so work with your nurse to develop a plan with foods higher in fiber, stool softeners, and laxatives if needed to establish a regular bowel pattern again. Initially, your incisions will be covered with a special dressing to protect the wounds and to allow them to heal without complications. Once the dressings have been removed, the bedside nurse will instruct you how to wash your incisions daily. You will need to wash the incisions daily with mild soap, water, and a clean washcloth. If you feel strong enough, you may shower once you return home. Preparing for home. Most patients return home 4 to 7 days after surgery, but going home involves planning and education. It's important we begin to plan early for your safe discharge. Each day, your doctor and his or her team will evaluate your progress and readiness to return home. A care manager will meet with you to arrange any additional medical assistance, such as a home visiting nurse or any medical equipment you may need. During the first week you are home, plan to have a family member or friend stay with you day and night. This assures that you will be safe and comfortable and that you will have assistance in following all your discharge instructions. Once home, continue to walk daily to regain your strength and endurance. This will prepare you for the outpatient cardiac rehabilitation program. This monitored exercise program typically starts 1 month after your surgery. Most patients are driving again when this program begins. We hope that this video has helped you learn more about cardiac surgery at the Fred and Lena Meyer Heart Center. Your surgical team will gladly answer any questions you may have. We are glad you chose Spectrum Health for your heart surgery.